because you have to know emergency can occur at any time. So it can occur like at home, or it can occur at school, or anytime. It can happen now also. So you have to know what to do in case of an emergency. So what we get actually when we are exposed to these type of emergencies, what will happen? We are very much tensed. We don't know what to do exactly. So in those situations, if you know what to do exactly, it will really help, because for example, a patient who is having a cardiac arrest, a child who is falling unconscious in front of you and not responsive, and if you are taking the baby to another hospital after 10 or 15 minutes, the child will die. You are not doing the life-saving interventions at that time. So that's very important to know few important life-saving techniques for few emergencies. So we are going to discuss 5 topics today. First, if the child is becoming unconscious, for example, a child is walking and suddenly become unconscious, what will you do immediately? So the 5 things which you have to do immediately. First, you have to make sure the child is safe. If the child is lying on a road, it is not safe to keep the baby in the road. So you have to move the baby to a safe place. So that is a first important life-saving technique. What you have to do? You have to immediately change the baby from the danger area to a safe area. That is the first point. Then check the response. Hello baby, just check the response. Ask for call her name or call his name, or check the response. If the response is there, then it is easy for you to manage. You just speak with the baby. What happened today? Did you what are you feeling? Are you feeling lightheadedness? Are you feeling syncope? Are you feeling headache? Some sort of questions you have to ask. So such questions are important, because you can know sometimes the child will be taking some insulin, will be diabetic, because type 1 insulin is common in children. So you have to ask the baby whether are you taking any medicines, have you taken the food, how are you feeling right now. So such questions are important. Then later on, next important thing is, do not raise the child or do not give water by keeping the baby in this position. So what you have to do, you have to raise the leg so that the blood which is present in the leg will come down, and it will increase, it will go to the heart, and it will improve the circulation. So you have to raise the leg for some time and speak with the baby, call for help. You have to shift the patient to some hospital immediately. Before that, if you want to give water, just raise the patient's head or child's head and give some water. Okay. So most importantly, you have to raise the child's head. That's more important. This is what you have to do in case if the child is unresponsive. Do not do anything else. This is the most important thing. And if the child is wearing tight clothes, you can just loosen up. These are the important points which you have to do. Do not crowd in front of the baby, because she needs more oxygen to breathe. So many people crowding is not a good option. So these are the things which you have to do if the child is unresponsive. So now, if the child is unconscious, these are the things. If the child is unresponsive, what are the things which you have to do? If the child is unresponsive, you're checking the response, no response. The child is not responding. Here you have to do another 5 more things. Otherwise, the baby will die within 10 or 15 minutes. What you have to do? Again, check the response. No response. It's an immediately you have to start CPR. If you are not activating the CPR, then the baby can die. So CPR, how to do the CPR? First, change the patient to a safe place. That is the first thing which you have to do. If you know how to check the pulse, you can check the pulse. How to check the pulse? The center part of the bone. Okay, the central part of the bone, we will get a prominent bone. Just palpate and see. Here when you palpate, you will get a prominent bone. Just 1 centimeter lateral to it, with 2 fingers, just palpate deeply. You will be getting a pulse. This is called a central pulse. So this is recommended in children more than 1 year. If children more than 1 year, if the child is unresponsive, do not check here. This is radial pulse, which is a peripheral pulse. Not enough for you to get that the child is not having a pulse. So you have to check a central pulse, that is in the carotid. Check for how many seconds? Minimum of 5 seconds, not more than 10 seconds. Palpate and see for 5 seconds, not more than 10 seconds. Palpate and slowly wait for that. If you do not know how to check a pulse, then skip this step and then move on to the next step. So shifting the baby to a safe place, calling for help. You have to call for help. Somebody have to come, because you cannot save a patient who is unresponsive alone. You need some support. So call for help, shout for help. Then immediately check the response. Baby is not responding. If the child more than 1 year, you check the response by tapping on the shoulder. If the baby is less than 1 year, you can tap over the feet. Just tap over the feet and see for the response. If the child is not responding, then it's an emergency. You have to start CPR. Where will you do CPR? The CPR to be done between two nipples. You have to find out two nipples. The center part of nipple is the area where you have to do CPR. How to do CPR? If it is an adult, you have to use two hands. Hold it like this. The heel of the area should touch the patient's chest and hand should be held straight, and you have to do this type of movement. The elbow should not fold. If it is a child, you can use one hand technique. How to use one hand technique? Just keep like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. If you are alone, you have to do 30 compressions. If you are two more people, if you are two or more people, then you can do 15 compression and 2 breaths, 2 artificial breath to the patient's or child's mouth. So I'll just do how to do. The child is not responding. So imagine this baby is more than 1 year. I am going to do CPR. So imagine that this child is 5 years. So I am going to save this child. How I am going to save? Just doing a one hand CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. I have 2 people. So that I stopped at 15. Now I have to give 2 breaths. How will you give 2 breaths? Tilt the head little bit, tilt the head. Take a normal respiration. Normally you take a breath and you have to give a breath. So blow to the child's mouth. Okay. If the child is big enough, you have to hold the nose and then you have to blow through the mouth. If the child is very small, especially less than 1 year, you have to cover the nose and mouth and give breath. So like this. One breath, wait for 1 second, another breath. So 2 breaths. Again you have to do the CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So 15 compression and 2 breaths. You have to continue till the child become responsive, or if you are getting a help from a medical people. So till that time you have to do the CPR. How the CPR is working? The child's heart is stopped due to some other reason. We don't know what is the reason for it. It is stopped. So we have to restart. We have to restart by pressing on the heart, because it is a rhythmic contraction. So normally the heart is beating like lub, dub, lub, dub. So it is a rhythmic contraction. So the same rhythm you are trying to activate by externally, by pressing over the heart. So when you press, whatever blood which is present in the heart, it goes to the brain, liver, kidney, so that those organs will not get damaged. So continue the CPR as much as possible. So the heart will understand how I have to contract. So the heart will get that rhythmic contraction very soon and will start contracting. So this is how we have to do a CPR. If it is a child less than 1 year, instead of using one hand, you can use 2 finger. 2 finger between the 2 nipples over the hard part of the bone. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then give 2 breaths. then continue the same thing. Okay, if you are two people, you can use the thumb encircling technique also. You can hold like this, keep it like this, and thumb encircling technique. It is called as thumb encircling technique. Just press like this: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So child less than 1 year, you can use either 2-finger technique by pressing like this, or if you are 2 people or more people, then you can do a thumb encircling technique. But breath, you have to do like, you have to take a normal breath and blow through the patient's or child's mouth. So this is very important, because CPR, if you are starting at hospital, for example, this child become unresponsive due to any cause, maybe a snake bite or panic attack or cardiac arrest or electric shock or any reason. The child is not responsive, the child is not responding to your commands. Then the important step is to restart the heart. If you are not restarting the heart, the child will die within 5 or 10 minutes. So you will not get time to shift the patient to hospital. So this CPR to be done if the child is unresponsive. Hope it's clear. Now moving on to, if there is any bleeding, what will you do? So bleeding, a child is having a bleeding. Bleeding can be due to any reason. It can be due to a cut or fall or anything, or due to a sharp object or something. So if there is a bleeding, most commonly the bleeding will be over the extremities, over the upper limb or lower limb. So if there is a bleeding in the upper limb, what you have to do? If there is a profuse bleeding, you have to cover it with a cloth. You take a cloth and cover it. Just imagine this is a cloth, and you have to take a separate cloth. You have to cover it over the area, press continuously. How much you have to press? Continuously means you have to press for 15 to 20 minutes continuously. In between, you should not take and see whether it is reduced or not. Never should do that. Continuously press it for 15 to 20 minutes. Then if it is soaking, if the blood is again coming through this wound, then put another cloth above this, and again compress. Continuously compress. So never ever take the cloth out. You have to continuously compress. And you can elevate the arm. Why you have to elevate the arm? Because whatever blood which is present in the arm should go down. So the arm should be above the heart. If the arm is above the heart, the bleeding will stop. So this is the second method to stop the bleeding. Another method to stop the bleeding, you can take few ices, cover it in a cloth, and you can keep over that area. So it will produce vasoconstriction and it will stop bleeding. So these are the methods to control the bleeding. Never put turmeric powder, paste, honey, because whatever available in the market has few impurities. So when you put some turmeric powder, all those stuff, the hand can get infected. So never ever put those things. You bring the patient to hospital. We can manage with the help of sterile method. If the bleeding is very small, if this minor bleeding, just wash it with soap and water. Then you can cover with a clean cloth and manage accordingly. If the bleeding is so much, you can take to the hospital. Otherwise, just cover it to avoid infection for 2-3 days, and it will heal by itself. So this is how you have to manage a bleeding. If the bleeding is in the leg, the same method, you have to raise it above the heart, compress the area with a cloth. If it is soaking, cover with another cloth. Immediately shift to the hospital. So this is how you have to manage a bleeding patient. Now, if there is head injury, a child is running and hitting her head somewhere, or child fell down from stairs. The child is having head injury. So somewhere some swelling or pain over the head. When you have to address. So it's very common incident. It's very common. Most of our child have these type of head injury. So you have to take the patient to hospital only if there is 10 warning sign. What are the 10 warning signs? 1. The child becoming drowsy. After the fall, the child is becoming drowsy. That means it is an indication to do a CT scan and observation. Child complaining of headache after the fall. It's an important step. You have to immediately shift the patient to hospital. A child who is having repeated vomiting after the fall. One time vomiting is normal. If it is vomiting more than that, more than one time, you have to shift the child to the hospital. The child is walking and saying that I am feeling weak, I am feeling like I am going to fall. Or the child is walking and falling again. That means there is some weakness in the leg. Again you have to take the child to hospital. Child is suddenly developing seizure, abnormal jerky movement. Then also it is another important sign, you have to take the child to hospital. Child is having loss of consciousness. The child lost the consciousness and unconscious after the fall. Again you have to take the patient to hospital. The child when speaking, having slurred speech, not able to speak properly. Whatever she is speaking, she is having slurring of speech. Again important point, you have to take this child to the hospital. If the child is complaining of any sensation loss, especially in the upper limb and lower limb, the child is saying that I am not able to feel the touch, I am not able to feel the pain over the hand, over the limbs, then also it is a warning sign, you have to take to the hospital. If the child is complaining of any visual problem, I am not able to see properly, I am seeing a person as double, I am not able to, everything is blurred, I am not able to see properly. If the child is complaining, again you have to take to the hospital. And finally, if there is bleeding from the nose or ear, or if there is any discharge from the ear or nose, this is also a warning sign. So these are the 10 warning signs which you have to know if there is a head injury. So any head injury becomes a danger if there is any of these 10 warning signs. If these 10 warning signs are not there, then nothing to worry. Just massage there, or you can keep a like an ice which you can cover in a cloth and you can keep it over the area. If the child is complaining of severe pain or something, you can give paracetamol. Paracetamol 15 milligram per kilogram is the dose. For example, a child who is having a 10 kilogram, you can give 150 milligram syrup stat, 150 milligram, not ml, okay? Make sure milligram is calculated properly. So these are the warning signs of head injury. Now final important point, if a child is getting burns, what will you do? If there is a burn, it can involve the outer layer, that is epidermis, or it can involve the dermis, the second layer, or it can involve the layer which is third layer, that is hypodermis, or even it can involve the bones tissue. So if it is involving the epidermis, we will call it as first degree burns. If it is involving the dermis, we will call it as second degree burns. If it is involving the hypodermis, we will call it as third degree burns. And if it is involving the tissues, bone, then we will call it as fourth degree burns. So most importantly, we have to remove the child from the hot area or the fire. That's the most important point. Second, wash continuously, not for 5 minutes or 10 minutes. Wash continuously for 20 minutes again. Continuously. Normal water, tap water, continuously you have to wash. Never stop. The child will say no need, the child will say no pain, but still you have to do, because the heat, it will slowly it will go little more deep and it can produce second degree burns. So you have to continuously wash with a normal water. Then what else you can do? If you don't put any creams. Most commonly they will put charcoal, they may put paste, honey. Don't put anything. If you want to put, you can buy and keep silver sulfur diazine. Silver, SULPHA sulfur diazine, DIAZINE. Silver sulfur diazine ointment, you can buy and keep. If there is burn, you can just apply over the hand or the leg, so it will heal and the pain will reduce. So silver sulfur diazine you can buy and keep. Then if the child is asking for water, you can give water, that is important. And if the child is complaining of pain, again paracetamol 15 milligram per kilogram can be given, so the pain will be reduced. So these are the important point if they are managing a burns. So if the child is still complaining of pain, after washing, what you can do, you can put a wet cloth over that area, so the pain will be further reduced. You can dip a clean cloth in a water and just cover it over the area so that the pain will be further reduced. Sometimes the cloth can stick over the body. Never pull it out because it can pull out the skin. So pour water continuously and bring the patient to hospital. Never ever break the bubble which is forming. For example, in second degree burns, we will get bubbles. Never ever break at home. We will do it actually in hospital. We will by following all the sterile method, we will remove that blood, but never at home, because what we are finding is most of the people are doing it and having infection. So these are the 5 things which we have to do in these type of emergencies. So first we have discussed about a child becoming unconscious. So unconscious, you are checking the response, the child is responsive. So there are the 5 things which I have explained. The second important point is the child is unresponsive, not responding to your commands. Then you have to do the CPR. The third important point, the third thing which we have discussed is bleeding from upper limb or lower limb or any area, what you have to do. Fourth point is head injury, what are the warning signs which you have to do. And 5, the burns, when you get a burn, what you have to do immediately. So these type of first aid have to be done at the where the emergency occurs. For example, if the emergency is occurring here, I have to start the management here, not in the hospital. So that you have to important, because first hour is very important. Whatever you are doing in the first hour is very crucial in managing these type of emergency, especially in case of child, because the child reservoir will be very less. So you have to act immediately. As a child who is unresponsive, you have to start the CPR immediately, otherwise this child will die. So please learn this first aid, teach other people, very important, because knowledge is important, then practice is important, and sharing knowledge is also important. You have to share this knowledge so that more people will be trained in first aid. That is first important thing. Second important thing, you will not forget whatever you are learning it today. And finally, you have to do some mock at school so that these type of emergencies can be easily managed at school. So by this, I am ending this session.